Good day. So I'm Dr. Veda. I work at MGM Healthcare Chennai as senior consultant, breast oncology and oncoplasty. Today I'm here to discuss or give a message on the occasion of the Breast Cancer Awareness Month. So as you all know, October is Breast Cancer Awareness Month all over the world. And the reason why it is being designated or assigned as the Breast Cancer Awareness Month is that breast cancer is the most common cancer amongst women all over the world. And the situation is the same even in India. So, even in India, the most common cancer amongst women is breast cancer. In fact, in 2020, the cancer statistics, the global statistics, and the Indian National Cancer Registry program came up with the data that Chennai has the highest incidence rate of breast cancer in India. Well, that's very troubling. So that puts a risk of about 1 in 25 women in India having a lifetime risk of developing breast cancer. Apart from the statistics, okay, so what can we do about it? Is there something that every woman or every individual can do about this gripping statistics? Yeah, definitely. So as an individual, we can definitely be aware of what is normal and what is abnormal. We can be aware of the signs and symptoms of breast cancer, so that whenever there is any abnormality that we feel, we seek medical attention. In fact, breast self-examination is the first step to go about. So every month, 1 week after your periods is the right time for every woman to be aware and to know about the breast, to see if there are any changes, and if at all there are any changes, seek medical attention. Now, the second step or second point is to know your risk. So, it is in fact interesting to know that the most important risk factor for breast cancer is gender. So, being a woman is the most important risk factor for breast cancer. So, even though there's not much that we can do about it, there are definitely other risk factors that we can try to modify or try to serve is gender. So being a woman is the most important risk factor for breast cancer. So even though there's not much that we can do about it, there are definitely other risk factors that we can try to modify or try to reduce. So that is why it is important to know your risk and know the risk factors. So just as gender is a risk factor, age is a risk factor. The older you get, the higher the risk of breast cancer. Apart from that, risk factors which we can actually work on is obesity or weight gain, physical activity, diet, alcohol, and hormonal pills. Breast cancer is largely a hormone dependent cancer. So most of the hormonal changes that occur in the body over a long time induces some changes in the cells in breast. In the long run can transform to cancer. So any hormonal pills beyond 5 years of time is not advisable, and it is better to seek medical attention. So knowing your risk, what else can we do? So knowing our risk, the next point is we need to adopt healthy lifestyle choices or habits. So that will include a diet which is free of junk food, less fat, and certain things to be avoided to decrease the risk of developing breast cancer. Apart from that, from the hormonal issues like hormonal pills, reduce the intake of hormonal pills, and other healthy lifestyle choices like physical activity. A minimum physical activity of at least half an hour a day, every day a week is the recommendation. And if we do it regularly, it reduces our chance of developing not only breast cancer but all other cancers also. The last point the last but not the least point is to get screened. So there are screening modalities available for women, for normal women who do not have any symptoms. So every woman after 40 years of age is advised to undergo at least a mammogram once a year or once in 2 years, so that early cancers or cancers are detected even at a stage when they are not felt as a lump. So 4 points to know, take home message is: be aware, know your risk, adopt healthy lifestyle, and get screened. Thank you.